Hi, I'm Dr. Michelle Randall, and we made this video because chances are if you're watching it, then your child is going to be using this topical Lidocaine Prilocaine cream, and we really wanted to go through and let you know exactly how to use it so it's the most effective for numbing the skin topically for the procedure that your child will be going through. I use it most frequently for molluscum. Molluscum is a viral skin infection, and we use an instrument called a curette, which basically scoops it off the surface of the skin. And so the lidocaine prilocaine cream works really well to numb the skin prior to that procedure. So you will have a prescription from your doctor for the lidocaine prilocaine cream, and this video will show you how to apply it so it can be the most effective for numbing. First thing to remember is that you want to use a generous amount. Now it's important to consult with your physician also because there are certain weight and age-based requirements on how much you can use at a time. So make sure you know exactly how much is the maximum you can apply at a time, and once you know that, then you can use sort of a pea-sized amount to cover each individual lesion. And then as you can see in the video here, we're using just a pea-sized amount, kind of globbing it onto each of the spots, and then when we're all finished covering all of the spots, we cover the whole area with saran wrap. I've found that the Glad Press and Seal, that sticky saran wrap, works really well to keep the area completely covered after applying the cream, because the cream does have to stay on for 1 full hour to be maximally effective. One other thing that I really want to be sure that you know is that it's important to leave that medicine on up until you're ready for the procedure. And so leave it covered with the saran wrap all the way up until we're ready to actually do the procedure, because if you take it off early, as soon as you take that saran wrap off, the medicine starts to stop working. And so we want to make sure it's on all the way up until the time that we need it. And it can stay on longer than an hour, actually. I mean, it's safe to leave it on up to 4 hours in older children, so don't worry about leaving it on for too long. We want to make sure you have maximal numbness. Hopefully, seeing this demonstrated will give you a good idea of how to apply it so that your child can have a pain-free procedure.